Hey, what's up guys? Dr. Kyle Loveless here. Hey, thanks so much for watching our channel, and I want to share with you today some things that I think are very valuable when it comes to your health. We're going to talk about pain, and we talk about psoriasis a lot, we talk about autoimmune issues a lot, and one of the things that comes with psoriasis and other autoimmune issues is pain. Your body, I mean, not just the skin and not just the cracking, the itchiness and things like that, but joint pain is actually very, very common with someone that has psoriasis and anyone that has autoimmune diseases, obviously things like rheumatoid arthritis and things like that. And it's something we've been very successful with in our clinics on helping people with the pain process. So I'm going to share 5 things today that's going to help you when it comes to pain. And you might be someone that has horrible pain that's just driving you crazy. You might be someone that's every so often. But these things will absolutely make a big difference in your life. But there's 5 things that you absolutely want to do when it comes to getting rid of joint pain. Okay? And I'm talking about the knee pain, your knees swelling up, things like that. You know, one of my favorite stories that we've had in our office, I guess a testimonial, is of a patient named Zoe, who's a younger girl. She's 4 years old, or she's 6 years old now, but I think when she came in, she was 4. And she's been suffering with juvenile arthritis for a very long, I think a couple years in her life. And she'd gone to the rheumatologist. He'd put her at a score to 18 on the rheumatology score, and said if we can get her down to an 11 in the next year, then that would be success. And they put her on methotrexate. I mean, her joints and her knees were just so swollen, wasn't able to walk very well, wasn't able to play and do a lot of things that she wanted to do because she hurt, right? And so that's really tough. And when she came into our office, the number one thing we asked, and this is what the things I'm gonna share with you today are from questions of asking not how do you get rid of pain and how do you get rid of inflammation in your body, but why is your body creating a chronic inflammatory response causing pain, right? And so that's the question we asked. Her doctor was asking, how do I get rid of inflammation? And that's easy, they give her methotrexate. We're asking, why is her body creating this chronic autoimmune response and inflammation in her body? And we addressed that by looking at her gut. So we looked at her gut. She had a 9 out of 10 on inflammation in her GI tract. And we did food allergy testing and found out there were some foods that were very sensitive to her. We started taking the food allergies out. She started to work on gut healing. We did chiropractic care. We did a lot of different things for her through that process. And 4 months later, going through this process, she went back to the rheumatologist. She'd been on methotrexate for that whole off methotrexate for that whole 4 months. She went to her rheumatologist, and guess what? The score was no longer 18, the score was 0. She was out of that score zone. And now I will tell you that when she gets increased stress and things like that in her life, some of the symptoms will come back because it's an autoimmune response. Our body's more susceptible to shifting into that. So the things I'm telling you right now are not cures. They're things that are gonna balance your body so it'll heal itself and so that you won't have to live with pain, okay? So number 1, we'll dive into this. Number 1 is curcumin. This is a constituent of turmeric. And you can take straight turmeric, but curcumin is gonna be more of a higher intensity, I guess you would say, of that turmeric, and it's not something you take forever. I would shift over to turmeric after a while, but curcumin in the beginning is very effective in that it blocks cancer, tumor necrosis factor, and there's lots of studies showing that it will help you in that autoimmune response. So curcumin is a big one. It's a strong anti-inflammatory, but it's not an anti-inflammatory like Celebrex or like ibuprofen, things like that. It doesn't necessarily block inflammation. It works with your immune response to balance inflammation, because inflammation is actually a good thing. It's what your immune system does to protect you from invaders, protect you from stressors, right? So we all need inflammation, but we just don't want it to be overrun, okay? So curcumin is a great start. The second thing in terms of something you can take is EPA, DHA fatty acids, or some sort of a omega-3 fatty acid fish oil or cod liver oil, something like that that's going to help give you the right fat ratio so that your cells won't be so inflamed. You've heard me talk about before on these videos where your cell wall is a lipid bilayer. It's a fat bilayer, right? There's 2 layers of fat, and it's the ratio of that fat is a 4-to-1 ratio of omega-6 to omega-3 fatty acids. Our standard American diet is more of a 20-to-1 ratio of omega-6 to omega-3 fatty acids, which means you're gonna have a lot more. Most people are gonna have a whole lot more omega-6s coming into their diet than omega-3s. And so taking omega-3s can help balance that fat ratio and give you the fatty acids you need to have a good, healthy cell wall. And when we have healthy cell walls, good things can get in easily, bad things can get out, toxins can get out, waste gets out of the cell, and the cell doesn't become so inflamed. So reducing inflammation, that's why fish oil has become so popular, is because of the fact that we're so high in omega-6 fatty acids. The next thing you can actually take, and I'm going to give you 2 more things to take and then 1 thing to do. The next thing you can take is something I've never really talked about in this video, but I've used it with a lot of autoimmune patients in the past, along with something called Romania. But you've heard me talk about Romania, but cat's claw. Cat's claw is an herb that is very effective at calming a T cell response and its overactive immune response, and it has been shown very effective for the patients we've used that with. So cat's claw is a great herb to use to just calm this overactive immune response that happens, is many times happening with joint pain, specifically someone with autoimmune response. Okay, number 5, and this is one of my favorite ones because it's so simple, it's so inexpensive, but it's apple cider vinegar. And you say, wait, I thought apple cider vinegar was for blood sugar, or I thought apple cider vinegar was for my stomach acid health. Yes and yes, right? It's very good for helping balance stomach acid. It's very good for helping your blood sugar levels. It's also really good to put directly on the skin and on your joints to help with inflammation. But taking 2 tablespoons a day in water is very effective for helping joint pain. Now, if you want to take it to the next level, add in there some Manuka honey, so you get that antioxidant, antiviral, antibacterial effect. Add in there some turmeric as well, and make yourself a little cocktail of apple cider vinegar, water, turmeric, and Manuka honey. And now you got this potent anti-inflammatory impact that's going to happen. And you do that on a daily basis, along with the other things I just told you to take, you're going to see inflammation reduce in your body. The final thing that you really, really, really need to do, it's not just about what supplements or what things you can take, it's what else you're putting into your body that causes inflammation. You hear me talk about nutrition all the time, and the reason I focus in on nutrition is because it's something I believe we can control. Most of us can control that. We all can control that. It's just harder for some than others. But we can control what goes into our body, and the foods we eat are so inflammatory. The average American diet is so inflammatory to the body that if we just shifted and took out some of those foods like gluten and dairy and soy and corn and all these foods that are normal staples in the American diet, and reduce the inflammation from the food standpoint, it's a huge difference. I know for me, this is a personal story about joint pain. For me, I played soccer in college. I went to Marietta College in Ohio, so if any of you know where that is. I went to college there, I played soccer for 4 years. And after playing soccer for 4 years, I had injuries. I hit my knees on goalposts and all kinds of stuff. I couldn't even walk upstairs without my knees just killing. I mean, it just felt like I was in pain every time I'd walk upstairs. And I was 22 years old, just like, what's going on? How am I having knee pains? Is this going to be the rest of my life? And it was pretty interesting. I didn't actually change my diet to get rid of my knee pain, but as I changed my diet from the things I was learning, right, in my graduate school and chiropractic school, the things I was learning taught me to eat differently. And as I started eating differently and I took out the pasta, the rice, the breads, the grains, and all this gluten out of my diet, guess what happened to my knee pain? Completely disappeared. I haven't had knee pain in years. And so it's just dietary changes can be very effective. So it's not just about what you take. It's just as much about the inflammation that you're causing, and nutrition can be a big role. So following a non-inflammatory diet is going to be very important, okay? Go back to my video I did on, literally the video is called Non-Inflammatory Diet. It's the core diet that everybody at a minimum should be following, right? If you want to go really advanced, you can follow the gut healing diet for psoriasis, but just simply enough, everybody should at least be following the non-inflammatory diet. So those 5 things right there will be very effective in helping with pain. I've had a lot of people asking, how do I get rid of joint pain? I've had people ask about disc health and back health and spinal pain. These are all things you want to do to help with those pains, okay? And of course, just kind of a bonus there is movement. Making sure you're moving all day long. Joints break down when we don't move enough, and so that's a big one as well. All right, hey you guys, make sure you subscribe to this channel, share this with your friends and family. Guess what? The #1 drug right now being sold in America is our anti-inflammatory medications, and the reason those are happening is because we're so inflamed, causing pain. So most of the people have some sort of pain issue. This video could help them. Share that with them. And yep, thanks for watching, guys. Continue to watch these videos to become your own health expert, and we'll talk to you next time.